Greetings, class, and welcome to Module 6. I wanted to take just a little bit of your time to introduce you to Chapter 6 and Chapter 7. Chapter 6 introduces us to hospital ethics committees, and I know that many of you may be familiar with hospital ethics committees, and perhaps you've been asked to sit on an ethics committee, or perhaps you've been asked for a consult. We know that there are a number of ethical challenges that present themselves in organizations today, and we can ask the Healthcare Committee to help us deal with ethical challenges in clinical practice. Members of the Healthcare Ethics Committee serve as educators. They also serve as advisors, and they oftentimes serve as decision makers. As well, typically you will see members of different disciplines as part of the Healthcare Ethics Committee. So the committee actually includes a body of persons that were established by the healthcare institution and assigned to consider, to debate, to study an ethical issue that was brought to them. And during this process of consideration, ethical processes are advocated with consideration to the benefit of the patient and the healthcare members as well as family. Now, the Healthcare Ethics Committee consists of several subcommittees, and two of those subcommittees might include policy, because of course, the Healthcare Ethics Committee will have a strong set of policies, correct? As well as procedures and guidelines. And then, so there certainly is going to be a policy subcommittee. There will also be an education subcommittee as well as others. There are a number of challenges confronting healthcare workers today, and there are a number of ethical challenges that are being brought forward. I want you to take some time to stop and consider, why are we seeing more consults today than we did 10 years ago? Why are more ethical challenges being brought forward to healthcare ethics committees? How do these challenges conflict with ethics-based care? When we look at Chapter 7 briefly introduces us to ethics and the management of health information. And while we have seen significant growth in health information in the past 10 years, we know that there are a number of legal and ethical issues that can arise in the management of health information. And I'm sure that you can think about a few of those right now. Some of those might include the protection of private information. How about patient safety, liability, and ethical dilemmas resulting from data sharing? How often have you heard about data breaches in the last year or two? I know that our hospital, our local hospital, recently experienced a data breach. The issues in health information is really finding a way to balance the need to protect the security of the patient's information with the potential for better care and outcomes associated with the improved ability to share records, perhaps between healthcare entities. There is some valuable advice that was given in Chapter 7, and patient safety must be, we know, the highest priority for healthcare information relative to information management. The procedures for health information must be clear and well established, and patient information must be held as securely as possible. So it's essential that healthcare professionals remain up to date on new regulations and rulings in relation to ethical conflicts, because we are seeing more and more ethical conflicts in the last several years. As you read through Chapter 7, I want you to keep one question in particular in mind, and that is, how do we manage healthcare information ethically? How do we manage healthcare information ethically with advancements in technology? We have seen, for example, with the electronic health record. I look forward to an interesting and engaging conversation this week for Module 6. Please do not hesitate to reach out to me if I can be of any assistance. Thank you so much.